Then from there, when it comes to our pediatric patients, obviously we have to decrease the exposure time. We try to make use of smaller sensors if it's possible. Some practices have a larger one for adults and smaller one for our pediatric patients. From there as well, we need to work as quickly as possible. We may have to actually even call mommy or daddy or even both of them to just come and assist us in terms of maintaining the patient and ensuring patient comfort. So again, when it comes to children, employ, tell, show, do. So you're going to try in layman's, in kiddies terms, to explain to the pediatric patient what we're going to do, and then try and demonstrate what you're going to do, reassure the patient to make sure that you are very positive, just to quell their anxiety, because they tend to be very, very anxious human beings. Speak to the child at eye level. Make sure that you are using age-appropriate terms, kiddie terms, just to try and explain what you are doing. Like I mentioned before, you may have to get the assistance of a parent or a guardian in terms of getting the patient to actually calm down and cooperate. Then from there, we're going to just touch on some common mistakes or errors. I'm not going to go through them. This table is very important. These are some of the errors and how to correct them. Please know them, understand them, and then you should be fine. So when it comes to placement errors, so this is basically when you do not place the receptor properly. So then as a result, it fails to record the teeth of interest, and then sometimes it results in the cutting of crowns or even the apices of teeth. So we have to make sure that we pay attention to detail prior to exposing the patient to radiation. We make sure that our location is accurate, that our horizontal and vertical parallelism is accurate. We ensure as well accurate alignment of the X-ray beam to the receptor center. Sometimes we may have to make use of cotton rolls just to facilitate proper placement and to allow crowns to be where there is greater depth and allow for parallel as opposed to angular placement. Then these are some of other alternative strategies that you can just employ. Just read through those if you see that you are struggling in terms of placing your receptor or X-ray beam. Then from there, ladies and gentlemen, we have vertical angulation errors. These are more common with the bisecting angle technique, but less frequently even the paralleling technique. So we have issues with essentially the angulation of our teeth. Okay, so when it comes to the paralleling technique, we find excessive elongation when a patient bites too forcefully and torques the receptor out of the correct vertical position. And then to correct this, we'll just encourage the patient to lightly bite onto our receptor as opposed to placing heavy forces onto our sensor. And then from there, we make sure that lingual placement is away from the teeth, placing the receptor teeth and the PID actually parallel to one another. So these are just examples of issues when it comes to the elongation of our X-rays. And then from there, we can even have horizontal angulation errors. So this can just result in overlapping of proximal surfaces, and basically they limit caries and alveolar bone evaluation. So to correct angulation, horizontal angulation errors rather, we must make sure that horizontal angles must be directed through the interproximal surfaces of our teeth, and for overlapping to not occur, we have to make sure that the receptor is not placed parallel to the horizontal plane of our teeth. And then from there, another error that we do find is cone cut errors, also quite common. This is just as a result of not centering the X-ray beam correctly over the receptor, where then when our resultant X-ray appears cut in that particular area where it's not correctly aligned, where our X-ray beam is not correctly aligned with our receptor. And then from there, we also then lastly have exposure errors. So this then just results in either a very light or a very dark image due to improper exposure, and this can essentially be corrected sometimes with software enhancement, but sometimes unfortunately, or most of the time, it causes you to actually take the X-ray again, resulting in you actually increasing the amount of radiation that you have given to a patient. But that's that when it comes to digital imaging, guys. I hope you've understood. I hope I haven't lost you anywhere. Any questions, again, under our YouTube channel, or send me an email. I will be more than free to answer your questions. We'll be interacting face to face as well. So if you have any questions for me, you can ask me face to face. Make sure that you study the tables that are found in part 1 and part 2 of these booklets, especially the ones that I told you are important. You will be making use of them even in private practice. So please know that, and then we should be okay. Now, ladies and gentlemen, see you on the flip side.